The title of this psychoeducational short is Narcissistic Personality Disorder. The Georgia Mind Center. Remember, you deserve peace of mind. This presentation is for informational and educational purposes only. It is not intended to be used as legal, medical, or psychological advice. Although we strive to provide accurate general information, the information presented here is not a substitute for professional advice, and you should not rely solely on this information. Consult with a licensed professional before making a psychiatric, psychological, professional, legal, instructional, and financial or tax-related decision. The topics covered are the following. What is narcissistic personality disorder? How is it diagnosed? And what are the most common treatments? What is narcissistic personality disorder? A person with narcissistic personality disorder may have a grandiose sense of self-importance, a sense of entitlement, and take advantage of others or lack empathy. A person with narcissistic personality disorder may have at least 5, or in some cases, all of these persistent patterns present. Grandiose sense of self-importance, a preoccupation with fantasies of success, power, brilliance, beauty, or perfect love, believes that they are special and can only be understood or associated with other special people, requires excessive admiration, has a sense of entitlement, is exploitative and takes advantages of others, unwilling to identify with the needs of others, is envious or believes that others are envious of them, and present arrogant behaviors. The interpersonal difficulties of narcissism include hostility and aggression, and this can make it very difficult to engage in a meaningful relationship. Recipients of the hostility and aggression often report that they feel as if though they are in a dysfunctional or abusive relationship. The elements of a dysfunctional, abusive relationship pattern consist of the following: honeymoon period, tension building, and explosion. These phases can interact with each other at any point in time, and the frequency varies. People diagnosed with narcissistic personality disorder are not without vulnerabilities. Those vulnerabilities typically consist of insecurity, hypersensitivity, depressed mood, shame, or an identification with victimhood. Now that you know what narcissistic personality disorder is, here is what it is not. It is not the same as borderline personality disorder. It is not the same as bipolar disorder, and it is not the same as schizophrenia. To learn more about bipolar disorder, borderline personality disorder, or schizophrenia, please take a look at our other psychoeducational short series topics. Here are some common tools used to assess for narcissistic personality disorder. These consist of the diagnostic criteria found inside of the Diagnostic and Statistical Manual of Mental Disorders, the Pathological Narcissism Inventory, and the Informant 5-Factor Narcissism Inventory. With all of the recent attention that narcissistic personality disorder has received, you may be asking yourself, is narcissistic personality disorder a new epidemic? And of course, the answer is no. It is actually quite rare. Statistics indicate that approximately 0.5 to 5% of the population has a narcissistic personality disorder. And of those people who have the diagnosis, roughly 50 to 75% are male. Currently, there is an absence of a standardized treatment approach to treat narcissistic personality disorder. Some of the more common options that are still under review for a treatment are cognitive behavioral therapy, psychodynamic psychotherapy, and transference focus therapy. If you'd like to do further research and learn additional information about OCD, you can reach out to one of the following organizations: the International OCD Foundation, the National Alliance on Mental Illness, or NAMI, and the Anxiety Disorders Association of America. Special acknowledgement and recognition of the source information used for the psychoeducation topic. If you or someone you know is in crisis, please call 988 for the National Suicide and Crisis Lifeline. Thank you for watching, and remember, you deserve peace of mind.